me, but I will do my best. Hopefully I won't blow anybody's ears or anything, because I tend to be a loud talker. I'm the oldest of 8 children, so I had to get everyone's attention often. And then I was also a lifeguard, and I've worked with children, so you kind of get the picture. What I want to do first is, being this, most of you, this is your first class of the morning, I want everyone to get up, get away from your computers. Everyone's going to end up coming down here. You will not have to talk, okay? What I want everyone to do is we're going to divide you up by preferences. If you consider yourself a dog person, I want you to come over here. If you consider yourself a cat person, I want you to go over here, okay? And Laura has to do it too. You're a cat hater. Whoa, okay, that's, there's always a few of those. I have a son that's a cat hater. This is what happened in the last class, so this is kind of interesting. Okay, now what we're going to do with the cat people is we're going to divide them up again. Okay, anybody up there need to be a cat person? No? Okay, cat people. Siamese cats, stay here if you have a preference for Siamese cats. If you prefer like calicos, I want you to just go up 3 steps. Do not be afraid if you're the only one that likes Siamese cats, because my niece loves Siamese cats, and I'm attached to 2 of them that I visit on a regular basis in one of the homes. Okay, now in our group, we're going to go German Shepherds down here, toy poodles up there. And when I'm saying toy poodles, I'm saying somewhere under 12 to 0 pounds. Well, not 0 pounds, I guess 5 to 12 pounds, kind of in that bed. Okay? There's a reason I do this, because I have a German Shepherd, so I like to, okay. All right, now the next one is, would you rather go to a checkup? Now this is a checkup with your dentist or with your doctor? Just a regular checkup. You're not going to have any fillings. You're not going to have any examinations, so to speak, just your general things. For women, it's a little bit different usually, but okay. Yeah. Okay. This is, okay, now we're not going to divide you up anymore after this. Now, this is an interesting one, okay? Chronic diarrhea or chronic constipation? No, no, I don't want a chronic diarrhea, sorry. Okay, this is the only one that's different. The last class, I think we had more chronic constipation versus, not that you are, but which would you prefer to have? Okay. All right, you can go back to your seats. Thank you. This is my informal surveys. This is how somebody who doesn't like to do research does her own research. Good morning. Do I know anybody just offhand from anything? The last class that I spoke at, what's this called? Child development. I spoke to Yehan's class a couple weeks ago, and after class, a young woman came up to me from Grand Forks that I do know and remember, and she was actually one of the first children I worked with almost 19 years ago. Her and her twin sister were on my caseload. So, and her mom and I see each other once in a while in the grocery store, and her older brother and my youngest son are actually friends. Talk about small world. Little bit about myself, and then I'm going to talk a little bit about what I do, and then I'm going to try to bring some of the questions that you have. One of the things I want to make sure you understand is that I do not have a degree in special education. I have a degree in social work. Okay, so I have a degree in social work from UND, and I don't have to be politically correct for the most part when I'm up here, because I don't get paid and I'm not in place, so I will always be a fighting Sioux. Okay, let's get that out there right now. The other thing is, I am probably one of maybe two social workers in the state that do the kind of work I do. And it's not because I'm special, okay? It's just because of the way things evolved probably in my career. I started out doing social work up in Cavalier. That was my first job out of school. And then I worked at the State Development Center, which is now, I believe, called the Life Learning Center. So I worked with children with incredibly profoundly mentally retarded with also incredible healthcare needs. Some of them are on ventilators, some of them didn't get out of bed, things like that. And then from there, I went to child welfare and worked at Grand Forks County. And from Grand Forks County, I went to Altru Hospital, and I was a social worker up in PEDS and ICU and OB for several years. And from there, I went to Ann Carlsen, except at the time, it wasn't Ann Carlsen, okay? We were just infant development. We were part of the Northeast Human Service Center. So the services that I work with are federally mandated. So that means there's federal funding that goes to every state in the country for early intervention services. And early intervention services are services from 0 to 3 years, okay? So that's one thing I want you to understand. So I work with children that are from 0 to the day before their 3rd birthday, okay? And like I said, it used to be called infant development, and then the state a few years back decided they didn't want to be providing, I don't want to say housing, that's kind of a generic way of saying they just didn't want to supervise us and have us under their umbrella. So different agencies around the state looked at the early intervention services, and the Ann Carlsen Center out of Jamestown now supervises and administers, and I'm going to draw the state of North Dakota here. I'm going to do my best here, okay? And this is the Red River. Okay, so, and we're going to divide it up just into 4, actually into 8 regions. So just like I said, we've got Williston up here, we've got Minot here, we kind of got Devil's Lake here, we've got Grand Forks here, this is Fargo, this would be Jamestown, this would be the Bismarck region, and then this would be Dickinson. So if you're not familiar with North Dakota, you just got your geography lesson. So anyway, Ann Carlsen Center is here in Jamestown, and they administer the 4 regions on the eastern part of the state. So they just decided at that point that they wanted to expand their services and do more things with what they had and just expand beyond just working with the children in their school. So they've been my employer for several years, and they are great employers. Okay, so as far as early intervention services, how you qualify for services is, like I said, you have to be between the years of 0 and 3. And things have changed. In November, I'll have been with this program for 19 years, so I jumped around a lot before that. So obviously I found my niche. And that leads me to one of the questions. Let me see what that was. Kind of like, whoa, see, I'm talking too loud. I should just think out loud. There was a question here that kind of wondered how I kind of got here. And I think it was just a progression. Obviously, I like working with children. I told you I was the oldest of 8. I grew up in Linton, North Dakota. Does anyone know where that is? Really? Whoa, who? Where are you from? Are you? Okay. Good thing you didn't say Strasburg or something. I'd be picking on you. So Linton is about 4 hours from here. And I came here to UND. Like I said, I'm the oldest of 8. I did a lot of babysitting. I was a lifeguard. And then when I came up to UND, started working at a child care center in town. So a lot of my work prior to getting a professional job had to do with children. But I also worked at a nursing home too. So kind of broad spectrum stuff. But this is kind of my niche. And the other thing is I worked in several hospitals. I worked at the State Development Center where I was in a hospital-based residential area. Does that make sense? I mean, these children were in their hospital beds. And so I just got a lot of information and a lot of knowledge that way. So all those things have kind of flowed into the job I have now. So in order to get into the program, and I'm not really crazy about any of these dry erase markers, so we'll have to see. I'm looking for a dark one. Oh, and somebody's got a permanent one up here. Isn't that cool? Let's get rid of that one so Louise doesn't use it. Yep, I just saw that too. So it might be through a diagnosis, and I abbreviate things, so hopefully DX is abbreviation for diagnosis. So if a child is born We're just going to pick on All True Hospital because I'm familiar with them. And we have a baby that's born there with Down syndrome, okay? That would be an automatic referral and automatic eligibility into our program, okay? And one of the things in our program that we talk about, have you talked about first person at all? Like, we don't say Down syndrome child. We say the child with Down syndrome. We don't say the autistic kid. We say if you're going to say the word kid, you're going to say the kid with autism. That's kind of just first person, putting the person before the diagnosis.
But is it also the same with saying like you wouldn't say he has Down syndrome before you say it's more with? Is there?
You know what? I would say, I don't think you'd get called on the carpet for anything like that. At least I would probably say both. I think there's probably more of a difference if you're writing it out in a report. I'd probably get pickier about how it's written phonetically. My mom's a school teacher, or was a school teacher, so I've got that kind of built into my brain. Prematurity. So I have a couple little ones on my caseload right now. Most of you familiar with what full-term gestation is? It'd be like 37 to 40 weeks. So when I first started this, I would say anything below 34 weeks was probably an automatic. Things have kind of changed based on funding and services. So some of the children that maybe were eligible 19 years ago when I started aren't eligible now because they kind of changed the criteria a little bit. I don't know if it's an automatic 32 or under anymore. A lot of times it's based on birth weight, but I have two little ones, 28 weeks, both of them. So, and it's amazing. We've had children that have been 24 weeks. I knew I'd been preoccupied till I found it. That have been 24 weeks gestation, survived, and have been assigned to somebody to work with. And that's kind of when you've been doing this type of work as long as I have, and I was at the hospital prior to that. I remember a situation where there was a 24-week baby being born, and I'm going to give you a year. Probably weren't even born then. Let's say 94, okay? And the OBGYN that was on the case is still in town, but he's retired. And they couldn't do anything for the baby at that point. The baby died. He or she was born and they died. They didn't try to put it on a ventilator or anything because they didn't have the technology at that time. So now we hear about babies younger and younger all the time surviving. So with that type of thing, I'm always going to have a job because of medical advances. The other thing that we get a lot of referrals from, and this has changed a lot too, is babies born addicted or exposed to drugs during the pregnancy. So, we just call that in utero. So we just put drug exposure. I told the last class, and I don't have any specific statistics to back me up, you're just going to have to believe me. When I first started doing this, if a mom, pick on the women, if a mom used marijuana during the pregnancy, okay, she stood a good chance, and that was documented, okay, she stood a good chance of having that baby placed in foster care at birth, okay? Now, doesn't happen. In fact, we're sometimes seeing babies that there's documentation, the mom used drugs, the baby was exposed, maybe there's even drugs in the system. There was I'm just thinking of one that blew my mind. And the referral comes to us, and we're working with the mother, maybe the father's involved, but the baby isn't in foster care, okay? And my main reason or my main thing with that is it's because of resources again. And I'll pick on Grand Forks County, and this is true probably for all the counties across the state. The resources just aren't there to place all these babies, all these children that used to be placed. Okay? I'm not saying it's right or wrong. I'm just saying this is how it's changed. Okay? And then sometimes we get referrals. I've got a little guy that I am going up to see up north here after I'm done. He will be 3 in January. And we're getting ready for what we do is prior to them turning 3, we have 2 meetings with the school system in their local school district. So we plan, if the child needs services after age 3, there's a transition process where they go into the school system. And then the school system at age 3 has to start providing services for the child. So I got a little guy up there. We started working with him in June. So he was almost 2.5 when he was referred to us. He had 2 words, mama and dada. Huge temper tantrums, liked to watch movies, had meltdowns pretty much about everything and anything. His pediatrician was sure that he had autism. I don't know what happened between 1.5 years and 2.5. I don't know who kind of missed the boat on this little guy. But he was diagnosed with autism about a month ago. He's got a few more words. He's involved with direct speech here in town and direct occupational therapy. But, you know, I don't know why he wasn't referred before 2.5. Because easily, there's a lot of times children with autism have, I don't want to say symptoms, have red flags is what we call it prior to that, but not all of them. Okay, I just had a mind fart here for a second. I'm trying to think of what I wanted to say about this little guy or the school system. Oh, it was about direct therapy. The thing with our program is we are not direct therapy. That's what I wanted to talk about. That's what I forgot to talk about with Ehan's class. What we do is after a child qualifies with our program, and they can either qualify with a diagnosis, and that can be an automatic at times. That would have been the situation with a baby born with Down syndrome. Because we know, even though, let's say this little guy is born in August, and he doesn't have any other special issues going on, he doesn't have any feeding issues in the hospital or anything, and he goes home, we know that even though right now, this little boy with Down syndrome isn't showing any global developmental delays, we know because of that diagnosis, he will be at some point. You know, it might take a couple months, it might take 6 months, but we know he's going to have a lot of challenges because of that diagnosis. So that's why that's an automatic. Otherwise, what we do is, and this is what I usually tell the classes, let's erase me. When we, I want to talk about some fun things too. We look at 6 developmental areas when we assess a child. I'm going to abbreviate these: gross motor, fine motor, cognition, toss that baby, social emotional, self-help, which is sometimes called adaptive, and communication. Okay, and within communication, we look at 2 areas. We look at expressive and receptive. And the last class didn't know what the difference was, so I'm just going to tell you quick. Expressive is basically what we say. So what you're expressing. What I'm saying right now to you is my expressive communication. You're receiving, your receptive communication is receiving what I'm saying. So it's what you understand. So if I ask a little guy, if I ask, there's a little boy on my caseload that's 20 months right now. If I give him a piece of paper and ask him to go throw it in the garbage, and he does so, he understands, and that's his receptive language. Okay? If I'm looking at a book, and I point to a picture of an apple, and I ask him what that is, and he tells me apple, he's expressing that he understands what this picture is. So these are the 6 areas we look at. There's like this little math thing we use, but the easiest way to do it is we have a 12-month-old child, and they're not crawling yet, okay? And typically, children walk. When I first started doing this, pretty much children typically walk between 9 and 15 months. That was kind of considered, you know, both ends of the thing. Now, and this is what happens after time, now a lot of people are finding even 18 months more acceptable. It hasn't changed on any of the tools we use, but I'm just finding that. Another example of kind of somehow how things change is under self-help. When my oldest son is going to be 31 at the end of this month. So when back 30 years ago, I'm raising my children. Children drank from open cups. Does anyone know what an open cup is? You don't have any in here because we all have coffee cups now and everything. But an open cup is basically with, you know, when you go to Perkins and you have coffee or you have a soda, nothing on it, no sippy seal or anything like that. That is an open cup. So somebody at some point, this is where I get on my soapbox, somebody at some point decided, and it was somebody with a great marketing tool, came up with sippy cups that have little spouts on the top that are just like, almost like a baby bottle. And so a lot of parents think when their children are drinking out of a sippy cup, they're weaned from the bottle and they're on an open cup. In my opinion, and I get on that a lot because, so anyway, at 12 months, back 30 years ago, children were supposed to be weaned from the bottle, which means no longer using the bottle at any time during the day, and getting all their beverages, all their liquids from an open cup. And it is incredibly sometimes difficult to convince parents that that's what their child should be doing. The 20-month-old that I was just talking about, when I asked him to go throw something in the garbage, he's still on the bottle. I've got another one that is 21 months old, pretty much takes everything from the bottle. That child doesn't have any words. I've just started working with him maybe 2 months ago, and I'm fairly certain he will be diagnosed with autism around his 2nd birthday. And I'm finding, I know the trend tells you that there's more and more, and I'm seeing that personally, just what I am not, and will never tell you I'm an expert on autism. Somebody had a question about that, and I don't feel I am. And when we're assigned children to our caseloads, a lot of times it's not based on diagnosis or anything. It's just based on who has an opening on their caseload, who travels where. You know, if they're way up here by the, you know, this is map in North Dakota again. If they're way up here by the Canadian border, it's probably going to be one of my other coworkers that goes up that way. So anyway, we have a 12-month-old that is crawling. So we're just going to make the assumption when we do the gross motor assessment on this child, he's going to come out at about 6 months, okay? And maybe his fine motor comes out at 9. Cognition is probably within WNL, which we would call within normal limits. So it's probably between, 11 to 12. Self-help, let's just put him at 6 months on that, just to have fun. Social emotional is at age level, he's 12 months there. And communication and cognition a lot of times go hand in hand, okay? Because with cognition, if I'm asking, or I'm giving you a puzzle, perhaps, and I'm asking you to I give you the dog, and I say, where does the dog go, or something like that. If you don't understand what I'm asking you to do, you probably can't follow through on something like that. So these go hand in hand, and a lot of times as a child gets older, they're usually about the same score. Okay, so in order to qualify based on just age, developmental age levels, you have to have a 25% delay in 2 or more areas, okay? And the reason I always pick 12 months, it's easy to do the math for anybody. But what we have to do is, it can get complicated if you have a 33-month-old that's got, 24 months a year and 18 there, and then we use the calculators, but I don't have to do it. So if I have a 12-month-old that has a 6-month gross motor developmental level, that is pretty easy to figure out. That's a 50% delay. So that child would automatically qualify for services with us. And then the 9 months at fine motor is a 25% delay. And then we also had, I think, 6 months here. So obviously this child would qualify. Yes?
Let's say, for example, you have somebody, they're like 20% in a whole bunch of areas, and then they're about 50%, 60% in another area.
Mm-hmm.
And it's according to the math, they don't quite qualify. I run into this as a teacher getting kids assessed for special ed, where it's like they're low, but they're not.
Well, in North Dakota, they would qualify because I didn't go far enough on this one, because if they have a 50% delay in one area, they automatically qualify. So he would have qualified just on the gross motor, okay? The other thing that we are allowed to do, and I guess the longer I do this, sometimes the more creative we become, because children don't qualify as easily, and I don't really like that term, as they maybe used to, because we were talking about the differences in foster care placements now versus, you know, back in the Stone Age when I first started. But we have what's called informed clinical opinion. So when we write out this form that we have to send to Northeast Human Service Center, and it's actually a team of 3 people that decide whether the child will qualify. We can put in there, child has an older sibling that was in the program 2 years ago and has this. We can put there's mother has clinical depression and is also dealing with anxiety. So some of those things can also, you know, have a plan. And if they don't quite qualify and we need to come up with, I mean, obviously I'm not lying about the clinical depression. I'm not going to make that up. But that if a child is going to automatically qualify, we probably wouldn't put that in it's called a dispo or disposition form. But if there's some areas that we're like, oh, they may not have this child qualify, we'll make sure they're aware of that. Okay, so what I usually talk about earlier in my talk is, this is where I like to, okay, I mentioned earlier that I have a German Shepherd, okay? And this is kind of what makes me special in some ways, is she's a therapy dog, okay? She's not an assist dog. You know the difference? Some of you? She is actually one of the few, she's one of 5 therapy dogs that's allowed in the hospital. And I just swallowed an ice cube, gotta let it melt. Seriously. But anyway, I oftentimes with my parents, and the ones that aren't going to be offended by it, and of course I don't say this the first time I'm out to see them. Oh, and okay, the other thing I want to make sure I get back to Lacey, my German Shepherd, okay? Give me a signal or something, okay? So when a child qualifies for a program, afterwards we write an IEP. Have you talked about IFSPs at all? Not yet? An IEP is what we in early intervention have, and it's an individual. Where's the one I like? Thank you. That's what I need is assistance. So an individual educational plan. So once they turn 3, and if they're in the school system and receiving services, then they would be on an IFSP. Whoa, 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 whoa. I got it backwards. Sorry. Shh, forget that. Just erase that. Do a Men in Black thing. We're the IFSP. We're the individual family service plan. Okay. Okay, individual family service plan. When they turn 3 and are in the school system, and this would be in their entire school time, they are probably going to be on an IEP, an individual education plan. Okay. And maybe some of you yourselves were on IEPs. My middle son was on one in grade school because of speech and handwriting issues, fine motor things. And then when he went to middle school, he was on a 504. So anyway, we write an individual family service plan. And the main difference between the two is this is obviously educationally based. So when you're in the school system, they're working on more cognition things, you know, knowing your colors, using a scissor, things like that. Individual family service plan might not be just the child. I have one right now where the mom wants to get her GED. So that's one of our outcomes or goals. Mom wants to get her driver's license. That's another one. So it can be things like that. But other times it might be just the child will use spoon and fork at mealtime. Some of those kinds of things. Okay, so back to Lacey. Is my German Shepherd, and she is the families that I feel like I can talk with this about. And most of our families we see once a week. We see them in their home. Once in a while we'll do kind of community-based visits, so we might be at a park. If a parent is really dealing with some issues with their child with running errands, we might meet at Hugo's, we might meet at Target. So then we strategize, okay, how can we get Milo to sit in the cart while you're, you know, shopping at Target for 5 minutes, and just some of those things like that. We have a play group that a couple of my coworkers have once a week at a local church, and so any of the children that are in our program or have recently left our program can come. Their siblings can come, so it can be kind of a group play experience. But what I often tell my parents is dogs and children are a lot alike, okay? And I don't know how many of you grew up with a dog or have a dog right now, and I'm sorry, cat people, okay? Because cats just don't fall into this category. But dogs and children are a lot alike. And I'll give you a couple examples. One, if you have your child that starts sleeping with you, okay, what happens? They want to continue sleeping with you, right? Okay, anybody have a puppy that they decided, you know, oh, this cute little Labrador Retriever puppy is only like this big. Oh, somebody's had the experience. Oh, let's just let her sleep with us tonight. Okay, I'm in the process of a divorce right now. So when I talk about my husband, he's not my ex-husband yet, but the 9-year-old Labrador Retriever that my son now has, one night when she's whining, oh, let her sleep with us. And I said, you realize when we let this 40-pound, and she's 40 pounds at the time, I mean, she wasn't a tiny puppy anymore, sleep with us tonight, she will be with us the rest of her life. Sure shit she was, or is. And she still sleeps with my son, okay? So the same with babies, okay? How about, and this one isn't quite as troublesome for children, but we have our 10-month-old at the table with us, and maybe we still have them on baby food, and maybe even the pediatrician is saying they're not quite ready because of prematurity or whatever to introduce a lot of table foods. But one night you're eating ice cream or something, oh, that would be really, let's just see if Milo likes, so we start giving him table food. Guess what? He doesn't want to eat baby food anymore because this stuff that mom and dad are eating is a hell of a lot better than that stuff in a jar that looks gross, okay? Same thing with dogs. You start feeding them from the table, what happens? Yep, you get beggars, okay? So I use these analogies with my dog a lot. And then I usually explain, I'll tell a story about her when she was a puppy, and then I always phrase it as, and we know your child is a lot smarter than my German Shepherd. Because a lot of parents do not think their children are going to remember this, are going to do this, you know, the next day. And they do. Children remember. Okay? And like the sleeping in bed, that is a whole issue. And I do not get judgmental about it. I have my own personal and professional beliefs about it. But if a parent is sleeping with their baby, the only thing I make sure they know is that I'll say to tell them, I don't support co-sleeping because of the safety issues. And I'll document that for my own protection, so to speak, but I don't tell them over and over every time I'm out, are you still sleeping with that child? You have to stop this, because that's, as long as they know that I do not believe it's safe, those kinds of things. The other thing is, this is another one I wanted to throw into you, is like the American Academy of Pediatrics recommends that no children under age 2 have any screen time. No TV, no cell phones, no iPads, nothing, okay? Did you know the American Kennel Club came out with a recommendation that no puppies under the age of 6 months should have screen time? I'm shitting you. I just made that up. No, I just made, the American Academy of Pediatrics one is true, okay? But not the American Kennel Club, okay? I just wanted to see if anybody was listening to me. Okay, but screen time, okay, let me see, how much time do I have? A little bit. Okay, somebody asked me about my most rewarding case that sticks out. First of all, the thing that I really like about my job is I get out of the office. I'm not sitting at a desk all day. So I get out, I get to move. Sometimes that has its downsides when it's 20 below zero and I'm in and out, in and out, in and out. But I like the fact that there's variety. There are some families that I may be working with for almost 3 years, because if I get a referral that's straight from the hospital, this baby might be 2 weeks old or a week old, and I'm going to work with them for the next 3 years. Sometimes that is just a wonderful blessing. You know, there's a wonderful click. You feel like you're making a difference in this child's world, in this family's world, but not always. There's other times when you feel like you're pulling your hair out because the family doesn't make change. Or there's other things going on, and I want to, if we have time, have you done Maslow's hierarchy of needs at all yet? Okay, that's a good example. Being you already have that, I'm not going to draw it out for you. But if we have a family, and I mentioned the one earlier a little bit ago, we were talking about the IFSP, where the mom that's working on her GED and she's working on getting her license. That mom is also a victim of incest. And her father, her biological father, she's somewhere in her 20s. She has 3 children. Her oldest child is a product of incest. Her father is serving prison time in a Minnesota prison for that, okay? So she's also dealing with, she's looking at being diagnosed as having a permanent disability of anxiety, depression, and post-traumatic stress disorder, okay? So she's with a man right now who's the father of her 3rd child. So she has 3 children, 3 different fathers. He works seasonal type work. This is kind of one of the, is it a genogram where you draw different things and things like that? So I'll probably put a couple notes on this board just so I don't repeat myself. He's a little bit old. Neither one of them are educated, as far as I think her boyfriend, let's just call him Joe. I think Joe has a high school education. He works seasonal work. Last year in November, he was in a car accident. His jaw was broken. And I wasn't working with the family then. So this is based on other professionals giving me this information. And there was some concern that he was becoming addicted to opiates or pain medication. Mom, let's just call her Liz. Like I said, is I'm just going to say she's 26. The oldest child, I think, is 6. We got a 2-year-old. Now she's almost 3, and this one's almost 1. He's the product of the incest. Lots and lots of physical anomalies. Do you understand what anomalies means? Kind of physical anomalies would be like misformed feet, limbs, facial features. This is not a politically correct term, okay? So do not write this down. It will not be on a test, okay? But when I first started working in this field, and the pediatricians that I worked with, we'd sometimes refer to as a child that had a different look as a funny looking kid, okay? Or FLK, okay? And some of us still will say, kind of, and it just means they might have a syndrome that hasn't been diagnosed or things like that. So he's in a wheelchair when he agrees to be in it. Otherwise, he walks on his knees. Okay. This family was it's just an interesting scenario, even though it's someone's real life. Was reported to social services back last winter before I was working with him because he was showing up at school. He was picked up by the bus because he's in a special needs classroom. He was in special needs preschool. Now he's gone into a regular kindergarten classroom with a para, I believe. Was coming to school with feces all over him, okay? So it happened a couple times. He was reported. Grand Forks County started working with them. At the same time, her biological mother, so we'll just put bio grandma here, with her younger boyfriend, her 20-year-old son, and her 10-year-old daughter got kicked out of housing in Bismarck and moved in with them, okay? Nobody here has a job. This guy got a job. I think they moved in February. I think he was finally working by May, and he was doing seasonal work. Found out later she's an alcoholic. Obviously, still, well, not obviously, still has contact with her husband that she's still married to, who's in prison up here for the incest, okay? So a little bit of dysfunction, crazy dysfunction. And then I find out, because her older sister, who's Liz, tells me that her younger sister has been cutting herself. And I can't help it. Okay, this is just my dark side, my experience and things that happen. I can't help but wonder if this little girl hasn't already been victimized and sexually assaulted, maybe by him, who knows, maybe by him. But if something doesn't change, if she's not a victim yet, she will be. Okay, Grand Forks County finally convinced and empowered her enough to get these people out. So they're not in there anymore, okay? Now, this is, you're wondering where I'm leading up to Maslow, and I promise I will. Okay, so they don't have a car, okay? Grand Forks County, okay, see, it's October now. Early September, Grand Forks County, they followed through with everything they were supposed to do, blah, blah, blah. We have a meeting. I'm there talking about how they've done and all this. Does anybody have concerns? I did, and it was the car. You know, how, okay, then the other thing we add is, okay, this little guy gets picked up by a bus. Mom and social services got these two into early Head Start, which is within walking distance when it's nice out. Okay? Yeah. Who wants to walk across 42nd, North 42nd Street? Most of you know where that is. And walk to Lake Agassiz in the winter, pushing a stroller with two little ones in it. Okay? So I just feel like this is going to fail very shortly. Okay? But anyway, I spoke up. I just said, you know, I'm really concerned about the fact that Joe and Liz don't have a car. And how are they going to get one? And their credit history, for different reasons, for both of them is so poor. If his uncle co-signed a loan for him, he still can't get it. So I just worry about that. So then we go up to Maslow's hierarchy needs. I thought I'd drew it. So like the bottom one, you know, is air and food. Okay. And I'm being very general here. And then I believe the second one is shelter. And I'm not sure where an automobile would come in, but in North Dakota, I kind of feel like it's probably right in here somewhere, just depending on where you live and what you need. So if I'm going into this home, which I am, and I see them tomorrow afternoon, Mom is a chronic canceller, of course. Last week we were outside for our visit, which always raises my suspicions too much, because at another family, she was always trying to get me to meet outside, and finally I forced my way into the house. Not physically, but, you know, being charming. And I ended up having to report her because the house was so bad. So anyway, this child has no words, okay? And probably, I don't think she's going to be or is going to be diagnosed with autism right now. Maybe down the road it could be. But a lot of her behavior is based on what she sees this guy doing, because he has no words either. So I'm going into the home and I want to work on speech. Okay. It's pretty hard for this mom to focus on working on speech when she's worried about how she's going to get the girls to Head Start, how she's going to buy them a winter coat, and where they're going to get a car, those kinds of things. You kind of get what I'm talking about? So we come in and we want to work on the child's development, but maybe the mother's involved in a domestic violent, oh, I'm not getting that word out right. Okay. A domestic situation that has become violent, let's put it that way. So I'm not getting my words out right. So, or she's worried about being evicted from her apartment, and I'm sitting there talking to her about how we want her child to start labeling body parts, or we want her to be singing the wheels on the bus with her child, so they'll, do more, have more interaction and work on early literacy. So that's where I wanted to get my Maslow's hierarchy of needs kind of in. So sometimes it's really hard to be focusing on that. And there's another question on what's one of the hardest parts of my job, and that's probably it right there. Because if I had lots and lots of money, and even though boundaries is a huge issue with this work, because I'm going to in someone's home once a week for 3 years. So let's just say that's 150 visits. You have to be very careful about keeping professional boundaries, because that example that I said where I got into the home and I had to report, well, if you become friends with someone that you're providing services to, it's really hard to report a friend. So that's why you have to keep that professional boundary. But what I was saying is, if I'd had lots of money, ridiculous amounts, where I didn't have to worry about different things, I hate to say this, and I've been doing social work for over 30 years, I probably would have found a car and have somebody anonymously give it to them. I really would have. And that would not have been the right thing to do, because my guess is the car probably would have been not taken care of, and within 6 months was a piece of, crap. And then I would have been angry about that and angry with them, even though I couldn't, So that's why you have to keep those professional boundaries. Okay, you guys almost done? Somebody had one in here, and I just wanted to, it was about working with a child with Down syndrome. And I have a little girl right now in my caseload that has Down syndrome, and she's usually one of my last visits of the day, and it's like, she just like, I don't know, just incredibly, I can have the worst day, and she's only a year old, and I just see her and my day just brightens. But my best experience, I talked about Lacey. We go to the hospital usually almost every Sunday, unless I'm out of town or there's something else going on. But we usually go to pediatrics, psych, and then down to surgical critical care after that. And then depending on time, ER, cardiology. But we also go down to all true pediatric therapy. And one Friday afternoon, we went down there, and I had the best time with this little guy. I think he was about 7. And he did have Down syndrome, and he was just so thrilled with her. And he was having her do the commands, and then later on we were outside with him, and he was working with the pedal bike, using his arms to pedal, and she was following him, and it was just great. And another time when we were up in pediatrics, it was actually a child that was on my coworker's caseload. But of course, even the next day or the following day, I couldn't tell my coworker that I saw this little child. But she was 15, 16 months old. She'd been born with her bowels outside of her body. So she had this surgery done, and it's actually more common than you would guess. And it was her second hospitalization in 2 weeks for some stomach issues. And she had a dog at home, but not nearly as big as Lacey. And Lacey has a very gentle mouth. And if you're not familiar with dogs, what that means is absolutely anybody can give her a treat. They can hold it any way in their hand or fingers, and she will not nip or bite their fingers. She will gnaw at it. She'll eventually get it, but she will not bite. So I trust her with very old people with very fragile skin and with very young children. So anyway, this little girl, her hands were probably about as big as my eyeglass part here. And so when she'd give Lacey a treat, almost her whole hand would disappear. And she was just so thrilled, and she had a big smile. We were doing that over and over. And her parents and her grandmother were so happy. She said, that's the first time she smiled in days. And then there was another little guy from northwestern Minnesota, because a lot of times I'll ask them their names and where they're from and things like that. And he'd been in with, he'd come here by ambulance. I don't know what for exactly. He was getting ready to go home. And just based on a couple things he said, I was pretty sure he was probably on the autism spectrum a little bit, just because he called my treats carrots and some of the things. Anyway, I can have taught Lacey to bark on command. So I usually prepare people for it. And this little guy, let's just call him Bradley, was like belly laughing every time she barked for him. So those, I mean, some of my really good experience with kids too come from my work with Lacey. But anyway, thank you very much. Yeah. I can't believe I stayed hooked up to this thing the whole time. Thank you.
Hold on a second.